Next slide. Next slide, please.
Visible, ma'am.
I'm not able to hear, and even the slides also.
Hello, sir.
Ravi sir, unmute yourself.
Is the slides visible, ma'am?
Yeah. Now it is okay.
Yeah.
Now, first slide. Right from the first slide.
Yeah, this is the first slide, ma'am.
No, before this there is a slide.
No, before this, we don't have any slide, ma'am.
Beginning of the slide. Sir, go for the first slide. This is the third slide which we have.
Yes.
Yeah, next slide.
Yeah.
Yes. So disease reversal or the reversal of the disease is restoration of the body, the well-being state of the body. And here explaining about the underlying cause of a disease and managing the symptoms of a disease. And here, why do we do such thing is because it will lead to the healthy outcome, and also the economic, it reduces the economic burden on the healthcare system. So this is the main cause where we have to reverse the disease to enjoy the well-being state of the health. Next slide. Next slide. Yes. Are we ready for the disease? Are we ready for the medication? And is there, like, can we overcome the disease? Can we overcome the adverse effects of the medication? And are we ready to face the complications of a disease? This we have to think before you welcome a disease. Next slide. Yes, it is always better to maintain the health rather than tolerating a disease. And we have a set of chronic diseases like cardiovascular disease, diabetes, obesity, where we need certain lifestyle changes that has to be taken place. And in order
Dr. Sailaja Rao, ma'am, unmute yourself. Unmute yourself, please. Yeah.
yes, now it is audible.
Yeah.
So the chronic diseases will be concentrated more like cardiovascular disease, diabetes, obesity, where we need to employ certain lifestyle changes in order to cut the progression of the disease. Next slide. Next slide. Yes, what is the science behind a disease reversal? Now, understanding the root causes of the disease, then identifying the specific mechanisms, whatever we have, then implement the targeted interventions if it is needed. Of course, it will be needed. Further, I will be taking elaborately. So this will enable us to correct the genetic effects, and then the immune system, protecting our immune system. Then maybe we have to depend completely upon the lifestyle factors for the contribution of the disease. Yes. Next slide. Yes, what is so here for the contribution of the reversal of the disease. So mainly we concentrate here to reverse a disease. So how is it possible for us to reverse a disease? So it is very useful for us to do this so that we can combat the diseases attack, and then followed by the complications of the disease. Next slide. Yes, what is the mechanism which is involved? So, the lifestyle, whatever the factors which are there, whether it is a diet or exercise or the stress management, it is going to alter the physiological process where it will improve the insulin sensitivity and the betterment of the cardiovascular health. Thereby, we can even modify the genetic expression of the disease by few mechanisms. Few mechanisms I have kept over here, that is DNA methylation, histone modification, and non-coding RNA regulation. Next slide. Yes, what is the role of the lifestyle changes? The best part of this is going to be the diet and the exercise. And what are these medical interventions are about? The medical interventions, like we can use the precision medicine, then go for the gene therapy, then adopt a few methods where you have a healthy restoration away from the disease attack. And we rely here on the longitudinal studies, because when the longitudinal studies are taken up for a long time, longer time of interval, or you can say the chronic study, we can say, then we can have the better effects and we can have the successful outcome, and we can have even the whatever the cons and cons, whatever you have, even that we can be able to judge. Next slide. What is the importance of the reversal of the disease? So here, as I told you, it will reduce the economic burden on the society, on the healthcare system. Then it improves the individual health outcomes, then improves the quality of the life, the longevity, then prevent the progression of the disease, that is the complication of the disease, then lower the mortality, increase the productivity, and healthy aging. This we can highlight it because as we age on, we try to depend on the medications. So this is more highlighted here, that is the healthy aging. Yes, next slide. Yes, case study. Now, if you take a case study, the successful reversal of the disease or anything for that matter, a motivation, an inspiration, that will be based upon the case study. Whatever the cases we study and whatever the cases we deal with. For example, we all know that we have chronic diseases like diabetes, hypertension, thyroid disorders, PCOD, etc. But here I cannot cover everything, so I have concentrated on one or two. So here the community health-based programs are implemented in order for improvement in the patient health metrics. That is the patient health, treatment, and the overall experience, including the adherence also, compliance also, of course. Next slide. So community health, like we can say that there are PHCs, primary health care centers, where even the uneducated people are given employment and they are explained. They will be explained about different diseases and they will be explained about the conducting some sort of improvement program, some sort of maintenance, some sort of protection from the diseases in a defined population, whether you take an area or whether you take a city or whether you take a region. So this is mainly this type of healthcare centers. They will concentrate mainly about the prevention and the primary care, what has to be taken, the vaccination campaigns, whatever the medical camps also they can conduct along with the people. And then the smoking cessation, which is the main you can say the cause etiological factor for every disease. I'll explain about this more detail because in PharmD we have a subject called as pathophysiology in second year. If you analyze each and every disease over there, in every disease almost you have the nicotine. Nicotine consumption will be the main factor which is going to kill a person, which is going to affect a person with the disease. So you get alcohol consumption and nicotine consumption. Both are the primary etiological factors. Almost You can say for each and every disease you see over here. So this is considered as a primary prevention, or you can say that stoppage of the smoking, and health education, like educating people in terms of the nutrition in order to prevent the disease, and also to have the nutritive value, whatever they eat, whatever they consume, whether it is a plant-based diet or it is an animal-based diet, etc. Next. Next slide. Yes. Role of the lifestyle changes and interventions which you have. So whatever the interventions which we are going to face it, or you can say that suppose if there are multiple risk factors, including the physical inactivity, unhealthy diet, tobacco use, stress, you should have you should be able to take every step to control all this. Take your time for the things whatever you have, and try to cut down the root cause of a disease. What is responsible for what? So in the further slides I will be explaining about that. So here we are more concerned and bothered about the chronic diseases. Next slide. Yes, this is about the case studies and the patient testimonials and outcomes, whatever we have. So here, if you see anything live, maybe we believe. If we see in the movie, we'll just see the movie and we'll just forget. Suppose if you see anything live, maybe we get influenced to some extent. Suppose if you have a person along with you who is living with you, and then who is able to inspire you, or who is able to do something successful, you get more inspired. So here, this is a patient testimonials and outcomes where the concentration will be more in such things. And see, if you come across any study, we just study and we just forget, we just imagine and we just forget. But here, if you come across such case studies or such people where they try to inspire you, or where they try to motivate you, that is very good for the well-being of the society and to maintain the health. So here inspiration and motivation are the two. For example, suppose we all know about Shah Rukh Khan, the financial status of Shah Rukh Khan when he started his career. Later on, he became the Bollywood Pasha. So we cannot become a Shah Rukh Khan. That is imaginary. But here, one thing we can do that, see, we get inspired by Sunita Williams. But here, the main thing is when we get inspired by the people, when you are in the right path, that is well and good. That is 101%, 200%, it is going to take you in a good pathway to reverse the disease. But when you are self-inspired, for example, suppose I just want to share one experience here, or you can say that some example or otherwise. So here what happens is, in a day, how we get self-inspired. So suppose in a week, 7 days, right? Sunday you take it off. Sunday is only for relaxing, or relaxing with the family, or whatever you want to do. In the 6 days, so there will be one day where we look beautiful, we look handsome, or we look very healthy. We take classes on time. We clear all the doubts of the students. Our students excel in conference. They get awarded, and that will be considered as a very good day, an inspiring day for us. So take that day as inspiration and get self-inspired and start your lifestyle, change your lifestyle so that you can prevent each and every disease. Next slide. Yes, here are the two case studies I want to present. So these two case studies, I am the witness for the case studies here. Left side, you can see the female who is 39 years old, marital status. Yes, no medication history. She never used the medication, no comorbid condition. And suddenly one day her HbA1c value was recorded to be 7 because she was a little weak and or little fatigued. So she got her HbA1c value tested, which we do for the evaluation for the diagnosis of the type 2 diabetes mellitus. And intermittent fasting, she has adopted some method to reverse her diabetes. And after 3 months, you can see her value was 5.9. So this change she could be able to do in 3 months. Right side, you can see young female who is only 28 years of old. Then marital status, yes. Medication history, comorbid condition, no. Her HbA1c values were 12.5 and no intermittent fasting. And she managed everything with the food, whether it is a plant-based diet or animal-based diet, that we will discuss later. After 3 months, she could achieve her HbA1c value 6.3. So this could be possible only when we have a commitment and determination. And I am the witness for both the cases. And I can tell you they were, after doing all this, like whatever it is, diet, exercise, intermittent fasting, employ some methods and then try to reverse the disease. They were looking very beautiful, attractive, very glow on the face, and they were very elegant. So I felt very happy in seeing them and taking them as an inspiration. Even this can be done. Next slide. Yes, this is the case which is posted by Dr. Sudhir Kumar from Apollo Hospital, Jubilee Hills. And here, Dr. Sudhir Kumar explains about one case, whatever the commitment which is there in this patient. A patient was like for the OPD. He came, he is actually a neurophysician. And the patient is 46 years male and he is suffering from hypertension. Suddenly, he was, of course, hypertension along with the antihypertensive medication. The chief complaint was weakness, and he was not able to sleep at night, and he was sleeping all day. Then, according to the doctor's diagnosis, like they will start some diagnosis, right? So he suspected as obstructive sleep apnea, and which he got confirmation by the sleep study. He got some diagnostic tests done, and then he advised him to follow healthy diet under the supervision of the clinical nutritionist. Of course, the physical activity is compulsory, and he was given with the CPAP, that is continuation of the airway pressure therapy. And then the follow-up was done after 1 month. The sleep quality was improved. No daytime sleeping. He felt more energetic. And surprisingly, after 3 months and after 6 months when he visited, after 3 months when he visited, his BP medication dose was decreased. And after 6 months, completely he is off with the medication and the BP is restored to the normalcy. So in 1 year, almost 8 kgs he has lost. So this is how our medical professionals react with, and they try to advise us, but I can tell you, even the negative effects of the medical professionals are also highlighted in some cases, but I don't want to point out any profession here. It is up to us how much we are educated, how much we can combat the disease symptoms, and how much success we can get out of this. Next slide. Yes, integrating the reversal techniques into the practice. Now, whatever the practice we are doing, like the current stand care practice which we are employing is symptom management rather than holistic treatment. Holistic treatment in the sense in every wise, like you can say that it includes even the palliative care also. It might be emotional, social, spiritual, environmental, occupational, everything, even financial also. But here the main aim of the reversal of the disease here is finally the patient has to get benefited and the burden on the healthcare system has to be reduced and the patient should be healed and healthy. Next slide. Next slide. Yes, the lifestyle medicine. You have a new medicine now that is called as the lifestyle medicine. To prevent taking the medication, you have to employ some lifestyle methods, and we can't escape from this because here for the healthy lifestyle you have to follow few things, whether it can be anything which will give you healthy atmosphere. Of course, the physical movement, here I have I have kept 6 pillars like physical movement, eating pattern, restorative sleep, management of the stress, avoidance of the risky substances, and the positive social connections, which are more and more important for the reversal of the disease. Next slide. Yes, examples of the lifestyle medicine like plant-based diets, regular physical activity, stress management, no disturbances in the sleep, positive social connections where those are considered, this last point is considered as a stress reliever. Next slide. Yes, dietary interventions, which is important over here, like low carbohydrate or high fiber diets are can be taken, and there is an exercise and physical activity also which plays an important role. Finally, the cardiovascular health is improved. There will be improvement even in the insulin sensitivity. Stress management technique. This is the most important thing which we need here, because last month I went as speaker for a conference conducted by Indian Pharmacological Society. I have delivered my lecture on intermittent fasting. So there, after my lecture, I met one of the principals of the college over there. Then he came to me and he was asking me about how to reverse diabetes and all. We were discussing. Then actually he was very lean, good personality, handsome, fair. Then he started talking about, though he's on physical activity, though he has very restricted diet, he's not able to manage diabetes. So he was asking me, Madam, what should I do? Then I said, everything is okay. What about your stress? Then he said, stress. Yes, I have a lot of stress. For what? You are the head of the institutions. You have institution. You have a team. You can direct them. You are not. You. There is no need for you to do anything. Of course, management is stressy always. I agree. But here the thing is, why you are taking so much of stress? Then he said, I overthink. Yes, underline this point. Why he has to think over? Sir, meditation, are you doing meditation? I just asked him. He said, yes. Then it has to work. Then what about your overthinking? And what about the spiritual practice? Then he asked, what is the spiritual practice? Doing everything as per your duty and then living to God. This is called as spiritual practice, sir. As far as I know, I am not a spiritual person or anything. Like whatever I knew, I just shared with him. Then he said, yes, I have to employ this. I have to incorporate this in my daily life. See, if one is imbalanced, whether it is a physical activity or a diet or a stress, everything will get hampered. You should be able to manage each and everything for the reversal of a disease, which is which is mandatory. Though his weight was under control, he is under control with the diet. So how long he can control everything? If we cut down, at last we can't eat anything. You have to try to balance the diet. Okay, this is more important. What type of diet we should have? That is more important. Then, next slide. Yes, this slide is a very important slide for my presentation. I was telling about self-inspiration. Whenever you look good, whenever you look smart, take just a picture of it and put it in your phone. Always, whenever you feel sad, whether or unhappy state, take look at that picture. This is me. This was me. I have to be like this. This is called as self-inspiration. See, if you are getting inspired by someone, it is well and good. Good. 100 marks, 200 marks you get, and then 100%, 200%, you are successful. But you are not getting inspired with someone, then try to hack the inspiration in yourself. This is a website, worldbiohacksummit.com. This is a website where biohack, it is bio means life. Hack is, all of you know what is hacking. So, whatever good things you do, whatever the inspirational day, whatever the happiest day you have in your life, highlight that in your life and just follow that blindly. This Megha Gupta, she's Mrs. Megha Gupta. She's a biohacker, holistic wellness expert, and actor. You will be surprised when I tell about her. She's 33-year-old lady. She suffered from type 1 diabetes. Type 1 diabetes, actually, it is an autoimmune disorder where the overactiveness of the immune system we see. And then she was diagnosed with type 1 diabetes at the age of 33. How will you confirm that she's suffering from type 1 diabetes? We examine the ANA, that is anti-nuclear antibodies. So she was diagnosed with those antibodies in her blood and she was confirmed. Her HbA1c value was 18.5. Can you just imagine? 18.5. She was broken into pieces. 1 year she was in depression. She was very much anxious. She thought to commit suicide at one stage. But ultimately what happened? She stood by herself. She got inspired by herself. She recollected her good days, her happy moments, and then she brought her HbA1c to 5.9. And she was on completely no carb diet. That is, she was completely on carnivore diet, which is there. And here she blindly followed that and she could be successful in 1.5 years. She was successful with her HbA1c value of 5.8 or 5.9. It was below 6. So, like when I heard about her, I was like overwhelmed and excited. Yes, this can be possible in every disease, not only with the type 2 diabetes, and it is possible with even type 1 diabetes. Maybe because of age, she was able to, we can say, the reverse type 1 diabetes, which is highly impossible. Next slide. Yes, this is Dr. Jason Fung. He is very obsessive about diet, about intermittent fasting, how to reverse a disease. So many cases he has taken up. To your surprise, actually he's a Canadian, he's a nephrologist. To your surprise, he has reversed the type 2 diabetic patient who was on insulin, and that insulin was 180 units per day. Actually, when we take insulin, more than 240 units per day, our body will not respond and the body dies. We die actually, literally. But to a patient 180 who was on the 180 units of insulin, was on such medication, even that person was reversed with his diet, with his inspirational speeches, with his, you can say, everything, whatever the lifestyle management, stress management, lifestyle, whatever we have to employ, everything that patient followed and he was able to do it. Next slide. Yes, she's Jessie. Jessie, she's a biochemist, actually. She's from France and she is obsessive about the glucose spikes. Always, she's not a diabetic, though she's not a diabetic, she always concentrate on the glucose spikes, and then she try to educate the people even right from the child. She even has a diet plan right from the childhood what we have to take, because you can I think you know the news that uh, I mean youngsters who are between the 20 to 30 years of age are more dying because of the heart attacks. This is because of major is because of the lifestyle and because of the stress. So she will tell us, she will inspire us what to take right from even the mothers also, educated mothers, everyone, what a child should be given right from the childhood. Very obsessive, very dynamic, very active. Once upon a time, she was on bed literally. 6 months she was on bed. Even she was thinking that, thought that life is over. Life is over and it has gone. I'm completely lost. Now I have to die. There is no other reason only except the death. Solution except the death. And she will conduct some small study programs. Recently, she has revealed one study. She has done on 3 patients, and she reversed PCOD in them completely with a plant-based diet. Next slide. Yes, innovative therapies and treatments we have. So here, novel therapies also we have at the genetic level, and recently even sickle cell anemia. I think all of you know about this sickle cell anemia. It's a genetic disorder. Now scientists have even tried to reverse this sickle cell anemia, and the research is thoroughly being carried out, and at the genetic level also we can do the wonders. And the other day when I was seeing one video, like a doctor was explaining, doctor come nutritionist was explaining that diabetes is no more a genetic disease. Actually, it is not a disease. Diabetes is only disorder. It is not a genetic disorder. Otherwise, you cannot reverse the diabetes. Because why I am stressing more on diabetes? Because India is going to occupy the first place very soon, and Hyderabad, the more and more it will be on the top. Okay, because of the time, I can't cover so many things here. So I'll just only the important highlights I just want to share. So, and pharmaceutical advancement here, understanding about the mechanism of the disease, how we can combat the disease, how we can reverse the disease. Then go for the complementary medication, go for the alternative medicine, and this I will talk shortly. Next slide. Yes, understanding about the mechanism of a disease and finding out what is the root cause and analyzing, assessing. Here I have taken, I told you, the example of the type 2 diabetes. And here, as so many cases we have with the reversal of diabetes, as I have shared about Megha Gupta, like she has reversed even the type 1 diabetes. So it's like that. Then next slide. Yes. This is the main slide, I can say one of the main slides where a sleep loss, a sleep deprivation is related to the inflammation. Why I have taken only inflammation? Because inflammation is related to so many chronic diseases. So with inflammation, the disease starts. So let not our body get inflamed. For that, sleep pattern, the circadian rhythm should be maintained over here. So fix the time, commitment, when you have to go for the sleep, when you have to be awake, and then the you can do the wonders. So here The sleep deprivation can be many factors are there. But first, that is maybe if there is lack of physical activity, also there is sleep deprivation. So if there is physical activity, 1 hour minimum, maximum you can say. I will talk about this also. So here, if there is physical activity, if our sweat is out, the melatonin, which is released, which is a hormone, which is released from the pineal gland, the brain, that will be released and it is going to control the sleep. Once the melatonin is released, you will be able to sleep 100%. You can try this. Still, if there is deprivation, then you have to employ some methods where you can combat this. But now we have late night sleeps because of the mobiles or because of whatever maybe. Here I told you, I shared you about the heart attacks which are there in 20 to 30 years. This is also one of the reason why people are dying at such younger age. Because one of my doctors, he's one of my friends, like he is a doctor. They have done some study and they have noticed that because of the use of the mobiles, the sleep disturbances occur, and then because of the chatting, mobile, browsing, everything late night mobile, that is killing your sleep, followed by the heart attacks. Literally, he has pointed out this and he discussed with me about this. This happened almost 6 months back. Next slide. Yes. Again, related to something related to diabetes. So let us keep this diabetes beside. So you're hale and healthy, but your food is not under control. Yes, your body will welcome all the chronic diseases. Glucose spikes, which is a hidden enemy in our life. Understanding the mechanism of the disease. So, which is more important here? I have no diabetes, I can eat 20 gulab jamun. I have no diabetes, I have no blood pressure, I can eat anything. Just come out of this. So it's not that I never say people not to eat. I say have limit yourself. So here, actually, why I'm more concentrated on this is, see, if whether you're a diabetic or whether you're not a diabetic, a doctor will decide. A diagnostic test will decide. According to American Diabetes Association, we have certain fixed values where we follow that. But keeping all this beside, a study was done in Stanford University by some scientific experts on the normal people in the year 2018. And what they have done, they just gave a bowl of cornflakes along with the milk and they have measured the blood glucose levels. Next slide. Yes. Now, when they have measured the blood glucose level, the glucose spike was more 30 mg of deciliter in 80% of the participants. This was really changed you can say a revolution. A revolution has occurred. See, for example, I ask you a question like, can a person who is normal can have 20 gulab jamun and can he have a normal blood sugars? Is it possible? No, absolutely no. It is not possible at all because there is a limit. There is a limit for everything in the human system. So what are these consequences? High glucose levels, they result in inflammation, glycation, that is indirectly aging, risk of the cardiovascular diseases, type 2 diabetes, pre-diabetes, craving for the sweet, hormonal disturbances, sleep, fatigue, being hunger all the time. Okay, hope you understood this slide. Next slide. So this is challenges and controversies in the disease reversal, like doubts we express, skepticism. Yes, you are doing this. If something happens to you, if you are following if you are going on right pathway, so many people will be there who will drag you from behind. So many things will be there. So here you should be able to combat all that. So maybe in the medical professional, maybe in the pharmacy, maybe in everywhere. Even our family members sometimes they discourage, but we should be able to do it. Then ethical consideration. This is the foremost and the first thing. Whether you take animal ethics, whether you take a human ethics, or whether you take a reversal of a disease, this is the first and the barrier, foremost barrier which we have. And then the other barriers which are implemented now. Next slide. Yes, ethical consideration. So whenever you go to some healthcare professional, they take so many things into consideration like confidentiality, benefits and risk, then patient education, they educate you fully, then ICF, you have to sign it, then other ethical implications which are there for the reversal of a disease. Next slide. Scientific and clinical barriers, patient-related barriers. This is all like encouraging and then discouraging. There is something you get encouraged. There is something you are discouraged. So here, whatever the barriers you have, whether training a healthcare professional who is well trained is able to guide you, or whether you fall deficiency in understanding a disease mechanism, or you don't know what is effective therapy, or you face all the challenges or some transitional barriers you have. Transitional barrier is nothing but you do it in the lab, but you know where you apply that. So these are all the both scientific and the patient related barriers what we have. Next slide. Practical steps what we implement. So first, get yourself educated, go for the evidence-based guidelines, evidence-based studies, then do some programs like about the patient education program, then focus on the personalized medicine. Like personalized medicine is again precision medicine, like what is suitable for me may not be suitable for you, it depends on that. Then patient related barriers, then do some research so that you can get good outcome of that. Next slide. Lifestyle medicine, this already I have told you about it. So whatever the lifestyle we are employing, that has to finally be beneficial for the patient, for the common man, for everyone. Next slide. The role of the healthcare professional, yes, a pharmacist. We are the frontline workers here, healthcare professional. What is the responsibility? What we have to take? The other day, I want to share one experience here. The other day, I was talking to one of the PhD students. Actually, she's not my student. She's a PharmD graduate working in some college. I was discussing with her about the urinary tract infections. Then I have asked her one question. Suppose if a patient comes to you with a urinary tract infection, what you will suggest? Or your family is complaining about the UTI. Of course, we get the urine tested, we get the culture tested. Before that, what do you suggest? Will you give medication? Then she said, no, ma'am, I will never give medicine to my family. I felt so happy. See, such awareness should be there. Such uh, non-pharmacological treatments or non-pharmacological steps where we can prevent the complications of the disease can be done. I will never give I will never give medicine to my family. I will ask them to employ some methods so that the UTI infection can be subsided. Sometimes it can be. Sometimes it can be, not all the time. So I felt very happy, like she's worth, like she has completed her family course and then she's into the academics, and such things happen. So such awareness is needed in everywhere. So here, like the role of the dietitian, the role of the exercise physiologist, training resources are needed. Perfectly, you should be able to uh, train the other people so that if you are perfect, you will be able to do it. Then behavioral therapeutics. Then here, whatever we face, the consequences or whatever we face in a chronic disease. Next slide. Patient engagement strategies. Yes, this is again self-care. Self-care, then you can say patient care, get inspired with the people or get inspired by yourself, follow up, don't leave it in between, don't uh, give a pause. A pause. A pause means a stop. So don't give that. Just remove all that from your mind and we can be successful in reversing a disease. Next slide. So what are the challenges that we come across? So constraints, I told you already about the few challenges. Skeptical colleagues, like they discourage you, sometimes they encourage you, sometimes they discourage you. Everywhere we have such an environment. I cannot say that it will be a healthy environment, but you should be able to manage how to live and how to be successful. Instead of pointing out others, think what we have to do. Be confident. Develop confidence in yourself. Next slide. Addressing the patient expectations and adherence. This is the most important thing. Even in the studies also, we concentrate on the medical adherence. So here also, we concentrate on the patient adherence, whether you are satisfied. This is the most thing where we need in every step, whatever we take up, and so that we can overcome the negative health outcomes. Of course, there will be negative things where we have to combat, but we have to keep them side and then move on. That depends only on you. Nobody will come with you. You have to be so much, you have to be so determined that you should be able to do it. Then healthcare professionals always will support, always encourage you, and they set goals. Now we have so many things, mobile apps, telemedicine, everywhere we have so many things so that people are helping us to reverse a disease in every aspect. Next slide. Yes, future directions. I told you about some digital health solutions such as mobile applications, telehealth resources, mobile application. I just want to give an example of my sister. My sister is overweight. She's not obese. She's just more than her body weight, just 4 to 5 kgs more. So uh, what she has done is she has downloaded one healthy app. So in the morning, that healthy app will give her a diet. So and so things you have to eat. In the afternoon, one. At night, one. So when she came to me to meet me from Bangalore, then she was showing me that app. I was surprised. To control the food, you should have an app. Then she said, see, you are there in your profession has got so many things. You will study so many things. Being a software professional, we can't do. We have to depend. 3 kgs I have reduced by following this app. Then I felt happy. Okay, this is going to give a change, a sort of small revolution. Follow it, no problem. But see that you have a balanced diet. So I just gave her that advice. So here everybody, right from a researcher, right from a practitioner, right from a pharmacist, a healthcare professional, everyone has to keep in their mind about what they have to do, how they can plan, how they can get rid of the diseases without medication, or go for an alternative medicine, like where it can be included in your daily life. Next slide. Yes, as a part of the FDP, now I just wanted to give some idea about the clinical nutrition courses. So why a clinical nutrition? Because as everything depend upon the food we take, even every pharmacist can start this course or can do this course out of interest, out of your interest. So a 6 months program, even a 1 year program, or a bachelor degree also we can do, and we can start even the consultation and online consultation also we can start. and we can earn also out of this. At the same time, we get inspired by that, and this will help us. Why a pharmacist can do? You may ask this question because we are more aware of the medicinal herbs. We study in our 4 year BPharm course about the you can say the medicinal importance of a plant, or whatever the plant based nutrition, everything. So we can do this course and we can be more successful than a non-pharmacist. Whatever I feel, that's why I just wanted to focus on this. So next slide. Next slide, please. So these are some of the colleges and some of the universities. I have put it in my slides. Next slide, where we can take up these courses, and we can even start the online consultation, 1 hour or 2 hour, and then uh, if we can earn from this also. Next slide. And this is actually this is I got inspired from one medical student. She was giving her interview because she was awarded with the gold medal. So when that host was asking about how did you feel after your medical course, then she was saying that she learned from that 5.5 years MBBS that food starts a disease and food ends a disease. This I liked it very much. So it is all about the food. Now it is open, it is there in our hands. What we eat, what we do, how we do, how far we can do, how better we can do. Lifestyle changes, whether you incorporate exercise or a physical activity, etc. Get inspired by other people or get inspired by yourself. It is up to you. Yes, I thank all the listeners for bearing me patiently. I don't know how far I inspired you all. Thank you, one and all. Thank you, MNR Group of Institutions, Dr. Ravi Kumar, Dr. Alagar Swami sir, for giving such a great opportunity so that I can reach each and everyone, so that my talk will inspire our lives so that we can be successful in uh, reversing our diseases without without failure. Thank you, one and all.
Dear delegates, now the session is open for questionnaire. You can, anyone, if you like to ask questions, you can unmute yourself and ask a question, or else you can post the questions in a message. You can add.
Any questions? Or you can message me or you can call me uh, individually also.
Any questions?
Yeah, a quick question. How can the intermediate fasting help us in reversal of diabetes?
Yeah, actually, for this, we have to understand the mechanism of diabetes, sir, here. How the intermittent fasting help. Like only in one line, I would like to explain. When we have the glucose spikes in the body, there will be release of insulin, right? Otherwise, we don't have insulin. We can't find insulin in the blood. So whenever there is control in the food, or you can say that the glucose spikes are not. And always there is optimal glucose levels which are there in the blood. Then the insulin will not be released from the pancreas. So intermittent fasting, like if this can be done, it depends on how many hours we fast. There is a 10 hours fasting, there is 8-hour fasting, there is 12 hours fasting, 16 hour followed by 18 hour. So it depends on, like, without losing any nutritive value from the food, whatever we get, if we are able to manage this glucose spikes, optimal levels of the glucose in the circulation, we can combat the type 2 diabetes. Followed by, we can even employ the autophagy method, which is the cleaning of the cells, etc., even with the 18 hours fasting. But 18 hours fasting is like, it is a huge period, it is a long period. It may not be successful with everyone. So you can follow from 12 hours to 14 hours. The simple mechanism is no glucose, no insulin. If there is glucose, insulin has to be released. Repeatedly, if the insulin will be released from the pancreas, there is a chance, every chance, that it may lead to resistance. Finally, the insulin resistance. Insulin resistance will lead to so many things, that is equal to, like, I have to take one more session. Uh, so many things it will lead to, all related to chronic ailments.
Thank you so much.
Thank you,
Thank you,
sir.
sir. Thank you. Hope you have got your answer. Any more questions from the audience?
Ma'am,
Yeah.
how far keto diet is helpful in reversing obesity? What are the complications of it?
Yeah, see, anything, what I advise is anything limited. Actually, frankly speaking, ketones are good for the body. But if it is exceeding to some extent, if it is more and more, the keto diet is not acceptable. It may cause the renal failure, it may cause the other complications. So anything within the limited, within the limits is advisable, and it is always welcome. So you should be able to understand the pros and cons of whatever we take up. That is why here, why the precision medicine has come into existence, why there is personalized medicine, because you are suitable for one medicine and I may be suitable for one medicine. So I may be suitable for one type of food and you may be suitable for one type of food. So this is all here. Individualized therapy is needed. Try to analyze what is suitable to our body. They are doing, like these are doing, I will also do. So such intention should never be there.
So you suggest intervention of a nutritionist will be helpful? Nutritionist?
Yes, nutritionist is always like they can guide us, provided they should be able to, like I have quoted some courses, right? So during this course also, you should be able to manage the clients. You should do some assignments. Then only you can be able to guide others, and self-guiding. Both are possible over here. That is why I have pointed out, for a pharmacist to start a consultation, the clinical nutrition, in my opinion, is the best option.
Thanks for the inspiring session.
Hope it's clear.
Yes, thank you.
Yeah, we have a question from Durgesh Gautam posted in a chat box. What's in your opinion about use of rice in our diet? Restriction of rice
See, actually, yeah, I will tell you something.
could be helpful in reversible of diabetes.
Yes. See, actually, shall I share my personal experience?
Yes, ma'am, you can.
Yes. See, like during my pregnancy, I was diagnosed with type 2 at third month, from third month onwards. So what doctor has done, endocrinologist, he is Dr. Merotra from Apollo Hospital, Jubilee Hills. He has put me on metformin. I asked him, will it harm my baby? Then he said, no, it doesn't harm. So have control on your rice. Okay. He gave me one diet, one chart where I have to record my sugars in the morning, in the afternoon, and at night. So I used to take carry my box to the college, and I used to have rice. After I ate, after I used to have the rice, I used to check my blood sugars. So, and the other day I used to have some jova roti and some sort of some protein food or something like, because I was conscious about my baby. So I was doing that. But whenever I used to have rice, my blood sugars levels were more. So from this till date, I believe that rice will increase the blood sugars. 101%. If somebody do research and they say that no, rice is not increasing the blood sugars, maybe in them, but I can't take a risk. It is all depending upon how much carbohydrates you take, how much rice you take. I think I have answered your answer. So here we can't exactly say that this food will increase the blood sugars, but like carbohydrate diet will certainly increase the blood sugars. That much I can say. But I have self-tested in I mean myself, and then I can say that 101%. There is every chance that there is a chance of glucose spikes when we consume rice. I think you got the answer because I felt this is the best answer I can answer you.
Yes, ma'am, I got it. Thank you, ma'am.
Yeah. Any questions?
Any more questions?
Thank you.
Thank you, ma'am. It's very
Thank
nice and informative session.
Thank you.
Now I request our principal sir to give a memento to our speaker, today's speaker.
Yes, yes. Thank you, Dr. Sailaja Rao, madam. Today's speaker, so you have done a wonderful lecture through online. I think all the delegates received well. So the way how they interacted itself shows that how much they could catch up your webinar. So on behalf of the MNR College of Pharmacy and all delegates, we express our sincere gratitude for sparing your valuable time with us. And I think it's more than 1 hour. I think everybody listened to your speech, and it has been also connected to the YouTube live for those who are unable to join in Zoom. So thank you, Dr. Sailaja Rao, for accepting the
Thank you,
invitation.
sir.
Kindly
Thank you so
accept
much.
this.
Thank
Kindly
you so
accept
much.
this virtual memento, madam.
Yeah, thank you,
Thank you,
sir.
madam.
Thank you a lot.
Okay. Okay. Thank you. Thanks a lot, madam. Thank you, all the participants. Hope we'll meet tomorrow with another exciting topic. Thank you.
Thank you, one and all.
Thank you all.
Thank
Today's
you.
session is closed. Again, we'll meet tomorrow. A session starts at 1 p.m.
Yeah,
Thank
thank
you.
you.
Thank you, ma'am.